All right, well, good morning. So my presentation today is going to be talking about uh, how research, in particular the clinical research, has really shaped how we use cognitive behavioral therapy for social anxiety. And you'll notice I called the presentation Living Through Amber Colored Glasses. So this is something that we call, we refer to anxiety as living through amber colored glasses. So I'm hoping to maybe talk about that today, about how that kind of gets started and what we mean by amber colored glasses. Again, my name is Ryan Ferguson, and I am a doctoral candidate at the University of Ottawa. So a little bit about me. So yeah, like I mentioned, I'm at the University of Ottawa. I'm completing my doctorate degree in clinical psychology. Right now, I'm just finishing my fourth year, so more into the program than less to go. Um, Primarily, though, I do work with adults with anxiety disorders. Now, I've sort of structured my presentation to be more focused to teens and young adults because the treatments are actually really relatively similar for those populations. But yeah, my um, expertise is with adults. My research, I do also research social anxiety, and in particular, sort of evaluations of ourselves and other people and how that may potentially um, play a maintaining role in social anxiety. And finally, and I guess maybe most importantly, why I am here today is I'm hoping and looking for ways to disseminate anxiety theory and research. And I think ultimately a lot of the work, the really important work that has been done over the past couple of decades on anxiety disorders and in particular social anxiety disorder may have been lost from the general population because it either goes into scientific articles or is presented at scientific conferences. So I'm hoping that through this conference, there might be more community reach to kind of present some of this to the community. So I'll ask that if you're watching this on the YouTube account, to maybe pause here for a moment and consider what are some of your initial impressions of social anxiety. You might recall, a friend or a family member who maybe is a bit shy. Um, you may contemplate maybe a child that you have if you're a parent, or you may think about yourself, maybe when you were growing up, or even to this day. Um, think about maybe what are some of your impressions about that, or sort of if there's an image that comes up for you, because that might be valuable. Because I hope that maybe some of that is likely factual, and some of that might be sort of social anxiety myths that I hope to maybe dispel a little bit during this presentation. So I have three kind of key objectives for this presentation that I hope by the end of the presentation, you'll be able to sort of identify for yourself. So first is I hope that you'll be able to understand how social anxiety can originate and maintain over time. Ultimately, this is really important for the treatment of social anxiety, right? Is for people to know, how it gets started. Of course, it can be on an individual basis, but we do have some research that sort of points to, in general terms, how one may experience social anxiety and why it might be difficult um, to reduce symptoms without treatment. Secondly, I hope that you'll be able to identify the key aspects of treatment for social anxiety, discuss that a little bit, especially through a kind of cognitive therapy lens. And finally, that, if you love someone, you care for someone who's experiencing symptoms of social anxiety. So in particular, if you're a parent of a child or a teen with, um, you know, symptoms that you might suspect would be social anxiety, to sort of recognize the steps and sort of where to go from there. So I guess to begin, right, we should start off with what is social anxiety. And I'm going to be talking sort of in and out about social anxiety and social anxiety disorder. But for the purposes of this presentation, I'll probably just use social anxiety disorder just for ease. But it's important to mention, right, that there's sort of a continuum, and I'll talk about that in a little bit. But you know, there's a specific criteria required for social anxiety disorder, which are sort of beyond the scope of this presentation. Um, but one may experience social anxiety and not meet social anxiety disorder criteria. So I believe it was estimated that, over half of the Canadian population was fearful of at least one social performance situation. Does that mean over half of the Canadian population experience social anxiety? No, but that may lead to someone to seek treatment even if they don't meet kind of our diagnostic criteria, which is especially if it's getting in the way of like work performance or interacting or making friends. So when we think of social anxiety disorder, it really is that persistent and excessive fear of one or more social situations where you might fear embarrassment or feel humiliated, especially if you um, kind of think that you might expose some anxiety symptoms, or you might show um, some of these like fears that we might predict might happen, which I'll talk about in a moment. Now, for social anxiety, we talk, of course, social situations where you are fearful. So talking to friends on the phone, meeting with new people, entering a classroom if everyone's already sat down. These sort of things could be really anxiety provoking. But what's maybe talked about less is these sort of performance situations. And this would be, someone would be not anxious at all about talking to friends on the phone or meeting new people or doing it, but they might be very fearful of giving a presentation in class, using a public washroom, eating in public, playing a musical instrument or sport in front of a lot of people. Now, like I was mentioning, right, most people, young people and adults, feel anxious in some of these situations. And that's really quite normative, right? You can probably survey, 10 people in your life, and probably all of them would say that they don't particularly love giving a presentation. But why do most people not actively avoid doing these? So when we think of kind of answering that question of when does it become a problem, we talk about kind of fear and impairment. So when fears sort of develop a little bit more closely, right? If we don't have a lot of fear, then we will likely not be a problem. We may feel a little bit uncomfortable. It might be kind of awkward, but we may not have a lot of significant identifiable fears. But someone with social anxiety disorder would likely be able to articulate some of their fears about entering these type of social performance situations. So, for example, someone might fear that they might go into this situation and sweat. You'd really see it under their armpits, or their forehead would be just kind of dripping. They may have an image of themselves sweating. They also may be shaking, so they may may pick up a mug and fear that the mug might shake, and that might be really obvious to others and lead to negative evaluation. Someone might stumble over their words. They may feel looking anxious, having another image in their head of what looking anxious might look like. That they may come across boring, stupid, or incompetent. Now, as it relates to kids and teens, um, we know that adults can better see these fears as irrational or excessive. Now, that's not to say that adults don't experience social anxiety, because that's not the case at all. But adults are usually able to, see these fears as uh, believing them quite strongly, but they can also see them as, sometimes not always present. Whereas teens and kids can sometimes not have that kind of cognitive component necessary to see these fears as irrational or excessive. So what do you do with these fears, right? There's that leads to a lot of impairment. So people with social anxiety might or avoid situations if they can. Um, what ultimately happens though is, sometimes it's unavoidable. Sometimes you have to um, talk to someone because you're doing a group project, or there's only one way to do this assignment, and that's via a 15-minute presentation. So you might try to kind of find another alternative, but sometimes you have to do it. And when you do enter these kind of anxiety provoking social situations, they're likely endured with a lot of distress. That's where we see either that avoidance or endured with distress um, as really being a sign of something more likely related to social anxiety disorder. Now, in terms of like impairment, right? So, if we have to endure this with a lot of distress, we may see some behavioral problems in kids and teens. They might just kind of freeze, not talk very much, especially in more of a social situation. They may even come across as standoffish, and that may lead to someone having less friends. So these are really important, right? Because when you read this list of kind of consequences to enduring socially anxious situations with distress, they don't immediately stand out as being social anxiety. You may think of other kind of concerns that are not at all related to anxiety necessarily. So that's why it's really important to seek an assessment for your child or teen, because for all these reasons. And I hope to share some more. So, I was talking about fearing negative evaluation, and that really is at the core. And we've known that since the kind of the early cognitive models. So, fear of negative evaluation would make someone feel really anxious. That's pretty clear. But even more recently, cognitive models and research has identified that there's also a fear of positive evaluation. So, someone with social anxiety may fear kind of discussing their own talents with others, complimenting or receiving compliments, praise from authority figures, fear of doing something too well, so as to not attract too much attention. I also see that we have another attendee in. So, just as an instruction, if you have any questions, you can feel free to unmute yourself and ask it or interrupt me. Like, feel free. Also, I have the chat open or the question and answer feature, so you can feel free to ask any question throughout. So, right, so we have the fear of negative evaluation that we've known for a long time. And then we have the fear of positive evaluation, which is a little bit newer. And that would lead us to think, people with social anxiety disorder likely fear evaluation in general. And again, that's a pretty broad statement, so it may not be present for everybody, but for many people, likely yes. So you might be thinking, well, like I have a shy child, but I don't think they have social anxiety, and you might be right. So we sort of see shyness and social anxiety on a sort of continuum, where kind of fearlessness is on the left side, no fear at all, and that's not incredibly typical, right? Most people will have some fears, whether that's social fears or fears of kind of like more of in a phobia sort of way of like snakes and spiders, or some may experience worries or kind of fears of uncertainty. So again, the bigger chunk, right, is these normal fears and anxieties, and within there is shyness. So shyness is kind of a typical response that some people may experience. That's more of a personality trait, and then that can sort of the opposite end can be more social anxiety disorder. And what we do know through research is that shyness in childhood is associated with the development of social anxiety. Again, that's sort of a directional relationship, but there's a lot of people that are shy in childhood that do not go on to experience social anxiety in adulthood. It is something to be aware of. So I won't spend today really looking at the sort of differences, but it's important that right? So shyness is that more personality trait, and social anxiety is a psychiatric disorder. Um, the other key importance, I think, is someone who's shy can socially engage when it's required and when they need to. But a person with social anxiety will be um, would likely avoid if possible, and may have poor social performance. And I'll discuss why that might be in a few moments. Again, shyness is really prevalent. You can probably think of yourself maybe as being a shy child, or friends of yours, kids in your child's class, whereas experiencing social anxiety is a little bit more rare. And the onset is very different. So a child may be shy in kind of as early as preschool years, but we know that the onset of social anxiety is usually early adolescence. And of course, the level of impairment, people who are shy usually don't have a lot of impairment, but again, social anxiety can lead to a lot of social and occupational impairment. So, the presentation, right, is called Living Through Amber Colored Glasses. So you might be wondering, what does that mean? What is amber colored glasses? We may have heard of rose colored glasses to think of somebody who is particularly optimistic or experiences a lot of gratitude. But what does amber colored glasses mean? And we sort of think about amber colored glasses like filtering out or filtering in threat. So in order to protect oneself from anxiety provoking situations, they may really see the world as kind of on high alert. So why might we begin to see the world this way? And ideally, or our initial answer to that question would be the presence of cognitive biases. So there's a bunch of cognitive biases, but I'll discuss a few here, right? So the first is kind of, we may have biases in our attention. So we would call that self-focused attention. I'll discuss that later on in what treatment looks like. But overall, that sort of would lead to we might be overly self-conscious about ourselves when we are in a social or performance situation. Okay. So we may have done something that we really regretted, like, oh, I shouldn't have said that. That came across really stupid. We have these thoughts that, yeah, that was really stupid. And that may lead us to feel very anxious and then become more self-conscious about how we're coming across. Interpretations, there's also been some really neat research on interpretation biases, right? So people with social anxiety may see ambiguous or neutral stimuli. So, you get an email from your boss and they say, can you come, um, we have a meeting, can you come around 2 o'clock? Or you might get called to the principal's office and these are sort of ambiguous or neutral, they're not negative, they're not necessarily positive either. People with social anxiety would see these ambiguous or neutral situations as negative. And even more so, people with social anxiety will also see these overtly negative situations as catastrophic. So you can imagine that that really can perpetuate the social fears. In terms of memory, this is a little bit closer to my research area, but we know that people with social anxiety often experience memory impairments. And this is actually a little bit related to attention, right? So if we're focused so much on ourselves and how we're coming across in a social situation or giving a presentation or speech, feeling very self-conscious, we don't really get a lot of additional information about our surroundings. And ultimately, what we'll remember is the negative information of how we felt and how we think we came across. So that's obviously a really important treatment target. And finally, another cognitive bias is biases in our judgment. And this is largely like the inflated ratings of probability and cost estimates of negative events. So someone with social anxiety may see a negative event as more probable and distressing. So, coming across, if someone stutters or, if they fear that they might stutter or stumble over their words, someone with social anxiety may see that as more probable and more distressing. So the sort of cost estimate that, everybody will notice and they'll all comment, they'll laugh at me, but that likely might not be the case. So yeah, how do we start interacting with the world this way? How does it get started? Now, to put it very simply, there's no one answer. our best evidence is that there's a bunch of different biological and psychological factors that really do perpetuate anxiety in these sort of ways. So we know there's heritability of some anxiety. There's also the kind of generalized psychological vulnerability that we would say kind of associating the world as dangerous or unpredictable. That may lead us to feeling more self-conscious and coping in sort of ways that maybe aren't so helpful. And then we think of more specific psychological factors or vulnerability factors that may be related to a memory of a particularly difficult social interaction, or knowing a family member who was particularly socially anxious. That may kind of remind us um, of the possibility of being negatively evaluated by somebody else. Now, some important considerations that can, sort of factors that can kind of swing in either direction, which, by that I mean like ameliorating or exacerbating a shy child's socio-emotional development. So this could either be kind of protective or risk factors depending on the types of how it kind of goes. So, I mean, one right is teacher-child relationships. That's really important for the child's development and kind of adjustment, especially since they're at school for a large portion of their day. Not right now, of course, but also language deficits. So this could be a receptive or an expressive language disorder. That may, if that is if someone is experiencing a lot of difficulties not getting a lot of support from that, that may lead to more risk of experiencing social anxiety, maybe because of the attention to oneself. And of course, you can imagine peer exclusion, right? And that's going to lead me to talking about bullying. So, um, a research study was done, I don't think all that long ago, where almost all of the individuals in the sample with social anxiety disorder as adults reported they experienced severe teasing and bullying in childhood. And understandably, this severe bullying lead to biased perception of themselves as being flawed or socially incompetent, or whatever the context of the bullying was, and that others are open to they're critical and judgmental. So again, this can really perpetuate and kind of keep people stuck. We also know that people with social anxiety make more upward comparisons, so thinking that someone is superior to them, and fewer downward comparisons, so thinking that someone with social anxiety is superior to them, to somebody else. So they're more superior. So that kind of social comparison as well may also likely kind of perpetuate some social fears. So kind of finally, before we kind of talk a little bit more about what kind of treatment looks like and all that kind of stuff, it's important that you know how we sort of have come to this understanding of social anxiety. And largely it was sort of early cognitive models in the 90s that really told us kind of how things keep going and how people kind of get stuck. So we know that, most people with social anxiety compared to other anxiety disorders like generalized anxiety disorder or phobias, etc., largely will feel anxious mostly when they enter a perceived social situation or a performance situation. So this, once they enter, this will sort of activate the assumption that, all eyes are on them and that maybe they're open for judgment. And again, this will likely lead to a kind of perceived social danger, and this can sort of lead to a sort of a loop, and again get people kind of stuck. So if you perceive a social danger, like there's a threat there, you're going to start to turn your attention inward and start seeing yourself as an object of judgment. So rather than kind of, talking to somebody, getting lost in their conversation, you might be really concerned, since you see the situation as dangerous. You will likely pay attention to yourself and how you're coming across. So because of the social danger, right, nobody really likes to feel really anxious for a long period of time. So what we're going to do is try to make ourselves feel better. And that's largely through what we would call a safety behavior. And I'll talk about that in a moment, but it's sort of these behaviors that kind of keep us feeling safe when escape is not really possible. And of course, we're going to experience a lot of physical symptoms within our body. Our heart might be racing, our vision might be a little bit blurry, we might really have a lot of tension right up here. We might be really sweaty or feel like our face is just red. And again, these sort of all work together. And we know that engaging in safety behaviors really does perpetuate this cycle. And I'll talk about that soon, right? So, what can keep us stuck? And I guess my biggest takeaway through my training is it's often what we don't expect that is the thing that keeps us stuck. So specifically, right, when we're about to enter a situation or during a situation, we're feeling really anxious. We may be pretty self-conscious and focus on how we're coming across. So we might focus on our inward bodily sensations, and we might focus again inwardly on our thoughts about, however we predict the situation is going to go. We predict we're going to come across as stupid, we're going to say the wrong thing, we're going to embarrass ourselves, we're going to blush or sweat or make some other type of social blunder. And overall, if we're being self-focused or self-conscious, we're really going to focus on how we're coming across to other people. Now, through the process of treatment, we really want to externally focus. We really want to get lost in the conversation or lost in the presentation if that's the socially anxious situation. We want to be aware of lights and sounds and colors and shapes and really get lost in what's happening in front of us. And ultimately, the expectation is that this person is going to enjoy the interaction a lot more, and they're going to have a deeper connection, especially if they're doing a kind of one-on-one conversation. So you probably remember me mentioning safety behaviors as kind of part of that cycle. And again, a reminder, these safety behaviors are things that we do before, during, and after a social situation to make us feel less anxious and more safe. And ultimately, this is sort of, again, like I mentioned, nobody really likes to feel anxious, but it's these behaviors that really try to cut that anxiety really quickly can really keep us stuck. So, for example, a child or teen may rehearse what they're about to say in their head before they actually say it. So, someone might be talking to them and telling the story, and the person is trying to think about what they're going to say next, and rehearsing so they don't it doesn't come out wrong, or they don't stutter or make an error. They may also come out, try to say something funny to come across as exciting, and that people will like them and not negatively evaluate them, rather than coming across as their fear of being boring or stupid. A teen may also particularly use alcohol either before, during, or after a social situation to sort of decrease their anxiety. You also might see eye contact avoidance, not looking at people in the eyes, sort of looking around at other places. Like I mentioned before, talking less. And again, like I mentioned, fears of shaking, right? You might grip your mug or cup really tightly. And if someone has fears of blushing, they might wear heavier makeup to, in the case that they did blush, it may not be as noticeable. Now, the issue, right, with safety behaviors is, we don't ever learn that, without kind of guidance from a therapist, we don't learn that if we don't do these behaviors, that our feared outcomes like will not happen. And if they do happen, if someone does mention one of our fears of, stumbling over our words, it's not as catastrophic as we initially anticipated. Similarly, right, if someone has fears of sweating, they may wear a couple extra layers of clothing as a safety behavior. However, as you can probably imagine, if you're doing a presentation and all eyes are on you and you're already maybe a little bit more vulnerable to sweating a little bit more, if you have like 4 or 5 layers on, you're going to sweat more. So there's sometimes these unanticipated consequences of safety behaviors that actually might even perpetuate some of our fears. So again, off the top of my head, right, if we rehearse what we're about to say in our heads, in order to come across as more interesting, we may actually not come across as we're paying attention, like we're paying attention to the other person, and ultimately that may lead the person to sort of not want to talk as long because, like, well, they're not really listening. So things to consider, right? And I guess this leads to what treatment looks like. And um, I guess, it's not always what you think for social anxiety. Um, so how we think about treatment is, cognitive therapy and perhaps any type of like CBT or psychotherapy might feel counterintuitive at times, but that's actually how the therapy works. So our perspective is, before therapy, you're likely experiencing pain with no gain. So this is, um, people will ask me and they'll say, well, Ryan, to, I do these socially anxious situations. I don't avoid talking to people. I have to give presentations for work, all these things. So why why have I not become used to these situations? Because I do them all the time. Like, I talk to people, I don't like it, but I talk to people. And that's sort of where you go back to that cycle, right? Of like, and my initial question would be, well, how focused were you on how you were coming across to other people? And the answer would usually be, well, yeah, I mean, yeah, of course, right? I don't want to make a mistake. And similarly, you may ask about safety behaviors. Do you do anything that tried to protect you from, making some errors? And or maybe you really rehearse what you were going to say, or you practice, every day for a week beforehand for that presentation, just to make sure that you didn't make any mistakes, so it came across perfectly. So that's really the pain with no gain. So you're experiencing the pain of these socially anxious situations, but without any therapeutic gain. Now, our goal for treatment is pain with gain. So we still go to these situations, but we judiciously drop the safety behaviors and we orient our attention outward so that there is a therapeutic gain here. Now, one kind of interesting way that we can do this, especially during the pandemic, I wanted to kind of focus on how we could do this in the pandemic. And there's been a lot of really great research that's come out quickly from really important researchers in the area of social anxiety. But in in the office, right? If we weren't in a pandemic, we would still do this experiment. So it's a self-focused attention and safety behaviors experiment. So now it would normally be just in the office and you record it. Now we actually do it over Zoom or another video conferencing platform. So what we actually do is we would, it would normally be, the child or teen, and specifically I'll talk about teens here, because this is something we definitely do with teens, and the therapist. And you'd say, well, I'm actually going to introduce, if it's okay with you, my colleague into the call. And I want you to have a 5-minute conversation and just do what you normally do. I'm going to record the conversation And I'm going to get you to just really focus on how you're coming across and, you know, talk to this person as if you're talking to, someone that you might be kind of concerned about, um, and do what you normally do. So, understandably, right, this would lead to a lot of anxiety, and this person probably would not enjoy the conversation very much. Then we would unexpectedly bring back the conversation partner for a second time and say, okay, we're going to do another 5-minute conversation. But this time, I really want you to do the opposite of what you just did. I want you to really get lost in the conversation, and that may feel almost impossible. But what you need to do, right, is really focus on what your the conversation partner is saying and respond in real time. Don't rehearse what you're about to say, and just really focus on what they're saying, what they look like, all these things. Focus externally. Now we're going to record it so we can be critical later. So don't worry about that. But for now, just really get lost in it. Now, what people would typically respond to this second exercise is they would have less anxiety and more enjoyment. Now, since we record them, so normally we would keep like a camera in the session if we were in person. But the thing about Zoom, right, is we can just record it on our screens. And if someone feared blushing, right, you might ask them afterwards, well, how red were your cheeks? And you might pull up a chart, right? And the person with social anxiety may imagine um, that they were blushing, and it was really noticeable to other people. And likely, if we go back to those cognitive biases, right, they may overestimate the amount of blushing and the degree to which it was noticeable by others. So again, we watch the video again, and they may actually say, well, it was maybe more like this. Similarly, um, we would ask a number of questions of the conversation partner that we write them down after the conversation. And if the person particularly feared coming across as, blushing, like, red like a tomato, some people might say, you may actually also give this chart to the conversation partner and say, well, can you circle how red you think the person's cheeks were? And again, as more evidence of kind of disconfirming what their predictions were. Now, the other part of treatment, right, is sort of what we call behavioral experiments. So these are doing things that are almost bringing on some of our fears. And we call those decatastrophizing experiments. So for example, if someone fears that they may come across as stupid or incompetent, we might get them to walk around the mall with toilet paper on their shoe, a really long one, and really bring upon the feeling of being looked at and potentially negatively evaluated. What we'd expect them to see is that people don't really care. That the learning would be, we really care a lot more about how we're being evaluated and how we're coming across than other people. Similarly, we may go to Starbucks and grab a coffee, and in front of other people, we might spill down our shirt. And again, we might expect that all eyes will turn on us and everyone will laugh. The reality, though, is that most people probably won't notice. And for the people who do notice, they may actually provide helping behavior rather than criticism. So I mentioned, learning, and learning is really important in CBT because, again, that's the pain with gain. So it's really important that we do these experiments for a reason. It's not just to do them to, suffer. There has to be a purpose for it. So someone before treatment may think, phew, good thing I rehearsed since last week. That job interview was really difficult. And again, before treatment, right, they may have this reaction because they didn't experience the situation without safety behaviors. So they don't know how they would have actually performed. Now, after treatment or during treatment, someone might take away that, that was a really tough interview. Using what I learned in therapy, I did remember I was a little bit self-focused at the beginning, but then I sort of remembered that I needed to focus externally so I could respond to the person and enjoy the conversation we had. Again, you can feel the differences in anxiety, and you can imagine how in the before treatment column that will likely kind of perpetuate um, using the safety behavior of rehearsing, and again how their safety or social anxiety will be maintained. And just to wrap up, what can you do if you love someone with social anxiety? So maybe you're a parent and you suspect that your child or teen might have social anxiety symptoms, even, right? Or you know a friend that um, might have some social anxiety. Now, when it comes to the family role, right? Parents and family really always want to help. Um, but it's important, especially when we're talking about anxiety, that helping can sometimes, not always, but sometimes accommodate the symptoms. So, for example, parents or teens may ask parents for reassurance that they didn't come across as stupid or incompetent, or they didn't stutter. So parents may unintentionally get kind of trapped up in these symptoms. And again, right, no parent wants to see their child or teen in distress. So of course we might, you know, tell them a reassuring statement. But again, that may just perpetuate the cycle of needing that when we feel sort of uncertain. Also, anxiety and social anxiety in particular can be pretty stressful in the family. So, a child may refuse going to school, they may be selectively mute, other things, right? So, again, you know, parents have enough to manage on their own. So, there can be sometimes a lot of stress, and sometimes it might feel just easier to um, give them what they need or what they say they need. Again, remembering that sometimes the opposite is what's helpful. It's important to seek support, right? Because it's not encouraged to just do the opposite, from one day to the next. That's not really all that helpful, and it's important to keep that relationship strong. So, what can you do then if you suspect that your child or teen has social anxiety? Initially, right, a psychodiagnostic and potentially also psychoed assessment could be really valuable. Now, this may look like, a semi-structured interview. You might be there if you're a parent, and the child or teen might be there, depending on what's required. All of you might complete a couple different questionnaires, and maybe the teacher from school. You have a feedback session about what the assessment showed. And also, cognitive therapy or CBT in an individual or group setting can be really valuable. And the good thing about this type of intervention is that it can be relatively short. So, as a final point, there are some also, there's some really great books that can be great if you're sort of just wanting to read a little bit more. You're not totally convinced that your child may have some symptoms of social anxiety, and you're wanting to learn a little bit more. These are two really great books about that are written from or written by really prominent anxiety researchers. There's You and Your Anxious Child, Free Your Child from Fears and Worries and Create a Joyful Family Life by Dr. Anne Marie Albano, and Helping Your Anxious Child, a Step-by-Step Guide for Parents by Ron Rapay. So the You and Your Anxious Child is actually both, if I remember correctly, are not just social anxiety, but also other worries, and I believe sometimes phobias too. So I think that's it for today. I want to save a little bit of time for any questions that we might have. But if there are, if you're watching this also after the conference or during the conference, but at a later date, and you do have a kind of burning question that you'd like to ask, or you want to know more about some of the research that I discussed, you can, of course, email me at rferg071 at uottawa.ca.